Hello, welcome everyone. I can see folks joining live right now. Fantastic, welcome. This is our webinar, See What's Next, Getting Real About the Future of Eye Care. I'm your host today, Jeremy Law. I'm a product manager here at Eyefinity, and I'm really excited to be able to bring you two special guests today for our discussion. First, we have Eyefinity President Charlie Biegel,
Hello, everyone.
and we also have Dr. Nichole Moos.
Hi, thanks for having me.
Yeah, it's our pleasure. Dr. Nichole Moos owns two practices in the Sacramento area. And today she and Charlie are going to be opening up about their thoughts on the current landscape of optometry, including things like emerging technology, trends that they're seeing, evolving patient expectations, and where all of that's headed and how they believe Eyefinity fits into that future. So we've prepared a few questions to get us going, but if you have any questions for Charlie or Dr. Moos, please go ahead and drop those into the Q&A chat, and we'll do our best to get to them at the end. Or, maybe if it fits nicely into our discussion, I'll bring them up, as we're talking. But just to get your attention, there's a little button I believe you can see on your side that has like a little question mark and Q&A. So do not be shy about putting questions in there. We would love to hear from you. That's the fun of doing these live webinars. All right. Well, with that said, let's go ahead and get started. So, I want to kind of kick off our discussion today talking about the current landscape of optometry. And both of you, I think, are going to have very unique points of view here. So I want to hear from both of you. We'll start with Charlie. Charlie, what trends do you see shaping the industry right now?
Yeah, thanks, Jeremy. I want to give a thanks to all our customers out there who made time to join today, and all of our to-be customers that are out there. A lot of trends out there shaping optometry right now. I think I'll touch on maybe three of them. First is there's a real workforce challenge. Practices are struggling, right, to find and retain qualified staff, which means from a technology perspective, we need to take that into account and make sure that newer team members can become productive faster and and then in turn reduce the burden on existing staff in the practice. Secondly, I think patient expectations have fundamentally shifted, and the patients expect the same digital conveniences that they get everywhere else. They want online scheduling. They want digital forms, text reminders, contactless payments. These aren't extras anymore. They're really table stakes that you need for staying competitive. And third, there's what I would call the administrative time theft problem, where practices are spending enormous amounts of time on tasks that don't directly serve patients. That could be like manual documentation, claims follow-up, payment collections, insurance verification, logging into all these different portals to try to get done the basics of their job. And really, I think the winners will be practices that use technology to reclaim that time. Dr. Moos, I don't know, if any of those trends resonate with you right now, or which ones are hitting hardest. But what do you think?
Yeah, no, I think you definitely hit the nail on the head with a lot of those points. I think especially the digital way that we communicate with patients, that's becoming a non-negotiable. I know my husband's one of those people, like if he can't make a online appointment, he's never going to see that doctor. He needs to be able to do it, after our kids are to bed. And then having the two-way texting with our patients has been tremendous as far as continuing the relationships. That is the main way that most of our patients are communicating, whether they be, our younger patients or our more mature patients. That's the main way that we're connecting with our patients, letting them know that their glasses are ready, follow-up questions if we have for them before they're coming in, and making sure we have everything streamlined for them. So yeah, that's been really huge as far as just streamlining the care that we're giving to the patients.
Yeah, I know my kids, if they have to pick up the phone to call someone, they're out.
Yeah, and for anyone who's hesitant to have an online scheduler, please look into it or at least try it. We probably get 10 overnight appointment requests. I mean, sometimes it's less than that, but I'd probably say on average between, and we have two offices, so maybe I'm combining both of those numbers, but it's a significant number of people who are making appointments when you're not open. So it's been really helpful to grow both of our practices.
Yeah, yeah, that's huge. I mean, for a lot of folks, they're working during the hours that your office is open. So trying to get, playing the telephone tag of like, I hate to say the olden days, right? A lot of us still do this, right? But it's like, I'm going to leave a message and they're going to call me back. I'll probably be at work. So then I'll have to leave another message. It's like to just simplify all of that. I mean, I totally agree with your husband, Dr. Mose. I'm like, if I can't book online, I'm probably going to look somewhere else. Um, Charlie mentioned another point. I'm kind of curious what your thoughts are about staffing challenges. Is that something you own two different practice locations, right? And you correct me if I'm wrong. There's three doctors total staff, including yourself. And you have all of your technicians and everything. Have you found like to what extent have you found it challenging to make sure that your practice is fully staffed and make sure folks are trained?
Yeah, I think all of us can agree that staffing is a huge issue. One, finding staff just in general, but then also making sure that they're competent in what they're doing. And at least at one of our offices, we've had a bit of turnover, and it just feels like we're constantly retraining somebody. So having a platform that's easy to learn and that minimizes mistakes, because at least for me, we've let me just kind of go back a little bit of history of my practice. So my first practice that I bought, it was all paper charts. So we had actually tried a couple other platforms before landing with Eyefinity, and just the amount of opportunity for mistakes and extra headache or duplicating efforts was quite apparent once we made the switch. So this has been really nice, just helping to streamline everything and just make it as easy as possible and creating the least amount of time commitment from each of those staff when we are short staff. It feels like other team members can pick up the slack when needed.
Yeah, correct me if I'm wrong. You when you first started using Encompass, you only had one practice location, right? So you opened your second location while you were already on. I mean, how was that overall? I mean, did you find that you were training your staff? I mean, to what extent? There's videos and things like that that Eyefinity puts out to help with training. What was that? What was that process like, bringing on a second location?
Yeah, so that was the easiest part of opening the second location was we just let you all know that we were opening the second location, and it was up and live, and we really was just an extension of the practice that we already had. So and I did pull staff. They were getting trained at the primary location, so they already had a background in the software. There wasn't anything new to learn. So it made it really easy. That was there always are some headaches going into opening up something new, but our EHR was not one of them. So thank you for that.
Yeah, well,
Yeah,
I'm really glad to
we
hear
try
that.
really hard to make that part easy, right? And that's the advantage of being on a cloud application, right? It's you don't have to stand up servers in the practice. Everything is connected from day one in the cloud, and it really minimizes the setup from a technology perspective. You need to scale as you grow locations.
Yeah, and that's
Yeah,
that's one nice thing. It's been really easy scaling. You had mentioned, we have three doctors. We all have slightly different schedules too. So, like in our scheduler, we can customize it for each doctor. If someone from the other office is calling me and I'm not at that location, I can just pull it up so easy, and so it makes it kind of feel like I can be present for both offices, even if I'm only at one location. So that has been helpful too.
yeah, yeah. Charlie used that term administrative time theft, which which I like. So, being able to have that bird's eye view of your entire business, all right, both of your practice locations, I imagine, that's been nice. Are there any examples you can share? Maybe things that you think worked well, or challenges you've experienced when it comes to like how Encompass helps you manage, your business as a whole?
Yeah, I think it's great from, our intake forms that you can have integrated with Encompass. Exactly what I'm putting into the chart gets pushed out to the optical. So there's less room for typos and mistakes unless I'm the one making them, which the staff appreciate that they can blame me instead of them if there's any of those types of instances. But there's just for less room for error. The opticians are putting, in their orders, and with one button, they're submitting everything to the lab and then also billing it at the same time. A patient invoice is generated at the same time and patients have access to it immediately. So there's just so many things that we can leverage that save us a lot of time.
That's really great to hear. We're talking a lot about sort of some of the nice features within Encompass, and that gets me thinking about, Charlie, what your vision as the president of Eyefinity is for Encompass. I'm wondering if you could speak a little bit to your overall vision for the platform, and what you're seeing Eyefinity do to meet the evolving expectations of both patients and all the providers that we serve.
Yeah, it's I think if you look at like practice expectations when it comes to their software, it's completely evolved since the time I started at Eyefinity, what it's been, I think 13 years ago now. When I started, it was like practice, we had very little cloud technology that was out there, and practices wanted software that was reliable and didn't get in their way. And today I see practices are asking more strategic questions about workflow efficiency and business impact. They're asking like, can the platform help me identify patients who haven't been in for 2 years so I can reach out before they're lost? And can it reduce the time my staff spends on insurance verification? Can it show me which services are most profitable or where I'm leaving money on the table? Practices aren't just asking for data anymore. They're asking for insights. They don't want another report to export to Excel and try to digest and make sense of it. They just want the software to tell them, like, here's your collections gaps. Here's your capture rate and how it compares to similar practices. Here are the patients you should be calling this week. It's a huge shift, really, from software as a record keeping system to more as software as your kind of personal business advisor. So it's fascinating to see how expectations, I think, of the practice have changed as expectations of their patients and have changed over time.
That's a great answer. I particularly like what you said. Practices aren't just asking for data; they're asking for insights. I think that's really interesting because that's something I've observed as well in my time working in this industry. Is it's not just about like, hey, I have a big place to just throw all of my notes. It's like, okay, help me leverage all of those notes and actually make decisions in a way that I'm not reading through pages and pages of text. You're able to summarize it for me. Dr. Mose, does that resonate with you at all? Are there instances in which Encompass is helping to provide you with insights to help you run your business?
Yeah, and maybe that's a better question for my office manager who's actually doing the managing. But yes, we are taking a lot of data. There's a quote, and we always use it in the office. What gets measured gets managed, and what gets managed can be improved. So, we have so much data in our EHR, and with patient demographics and purchasing, what they're buying, what services that they're coming in for. So we do, she gives me the report and we walk through all of those. But she's definitely using the data from EPM to help make those decisions, and for us to help manage, our KPIs, those key performance indicators that we're looking at each month. So yeah, it's definitely been helpful. I don't know if I can mention the exact nuances of how she's using those, but it's helping me and all of our staff to just bring better care and just continue to grow our practices.
I think it's fantastic that your staff are feeling empowered to hey, we want to be measure these specific things and improve these things, and that they're that they're feeling like they have a stake at the table to improve the practice and patient experience overall because of the insights they're getting. You mentioned some of the KPIs that you track. I'm sure that there are folks like yourself listening into the webinar. What are some of those key performance indicators or metrics that you track at your practice to kind of measure your success?
Yeah, so we're looking at capture rate, revenue per patient. We'll break that out with glasses purchasing patients and contact lens patients. We'll look at new patients and old patient percentages, and then attrition rate too. So yeah, how many of those patients, it's been 2+ years and we haven't heard from them. Where are they going? Can we get them back in the office and things like that?
Got it. Yeah, and those are things that a lot of those are available through the analytics that are kind of just come packaged with Encompass. I'm sure it would be interesting to do another one of these to include maybe folks from your office staff to kind of get into the nuances of what reports they're using and all of that. But definitely for anybody who hasn't been reading like all of the release notes, there have been so many advancements recently in the Encompass space around different reports that you can use right out of the box. You don't have to like create and customize your own reports to be able to get a better pulse of what's going on at your practice. Charlie, do you want to expand on that at all, or any other thoughts about how Encompass is trying to address some of those challenges that doctors face when they're trying to run their practices today?
Yeah, I mean, I think we've been making investments in a lot of areas that directly address many of the challenges that we've talked about so far, and it's really it's not just about digitizing old workflows, right? It's about reimagining how modern optometry should work, and everything we're building is focused on eliminating friction and giving time back to practices. And so let me give you a few examples of some of the things that we're working on that we're pretty excited about. First would be Encompass Scribe. So this is an AI-powered ambient listening tool that we believe will eliminate nearly 70% of the manual documentation work that doctors are doing today in the exam lane. And that's going to allow doctors to focus more on their patients instead of their screens. So, we'll be opening up our early advantage program here soon, right around the Vision Expo show, with some significant first-year promotional pricing. So stay on the lookout for that. Another thing is online payments. So that'll be launching soon. And that's about giving patients a mobile-friendly way to pay their balances. I think most practices try to collect what's due from the patient right at checkout. But sometimes after insurance reconciles, there's a balance due. And it's really hard, especially after people have picked up their glasses and they've gone on their way to collect that balance due, no matter how big or large it is. And so we think that by giving practices the ability to offer patients an easy way to pay that balances right from one click from their mobile phone, that'll just the staff spends chasing those collections and improve revenue flow for the practice. And then maybe one other thing, we're working really hard. We know optometry is going to shift to be more medical over time. It's already happening, that shift is. And so how do we better support the medical ecosystem? And one of the things we're doing right now through our partnership with TriZetto is integrating that claim status that happens with all the medical claims that flow through TriZetto. Today, practices are jumping out of our platform and checking the TriZetto portal to figure out what's the status of those claims. And so we believe we're bringing that integrated seamlessly right into the platform. And I think the checking the claim status will go from like 12 minutes to down to under a minute right inside of
Wow.
Encompass without having to switch systems.
That is massive. Yeah, you mentioned so many exciting things that are on the horizon for Encompass, and just I think just generally folks who are like looking at the technology in the eye care space, right? Advancements in AI, advancements in just saving practices time. I do want to talk about some of that future stuff. I one last question though for you, Dr. Mose, as we're talking about, things that you're using in the practice right now. Charlie mentioned like online payments, and you're using Patient Navigator with Encompass. Could you speak to maybe like what has been the response from your patients and from your staff since you started using Patient Navigator?
Yeah, we're really excited about Patient Navigator. Again, about like some of that time savings. Most of our patients have, a flex spending card or a health savings card, and they're always asking for an itemized receipt. Well, I think they don't really realize how much has to get billed and submitted before we can provide, a comprehensive invoice. And it is relatively fast at our office, but it might not be instantaneous. So it's nice that they can just go on Patient Navigator. We have it linked to our website, and they log in with their name, their birthday, and a cell phone number. And then they have access to their prescriptions and then also to their invoices. So you don't get all of those calls on people. Can I get a copy of my prescription? Can I get a copy of my invoice? That was taking up so much of our staff time. Now, if they ask for those things, we just text them the link to our website. Another thing I love about that, it drives patients to your website. So now you're getting more clicks on your website. So that's helping more patients find you later down the road, when they're looking for an optometrist in their area. So overall, it's been really great. And I also like that you can go in and see the metrics on how many patients are using Patient Navigator too. So more about that data, you can see, how many patients did request their prescription? Does that correlate with how many people were walking with their prescriptions? Things like that. It helps us just to improve overall. So we've been very happy with Patient Navigator.
Yeah,
That's awesome.
Dr. Mose, I know when we launched that product and we were talking to practices like early on as we were building it, there was some concern, right, that, patients are going to be able to get their own prescription online. I don't know how I feel about that, because is that going to promote people just, not purchasing from our practice? And when we were testing this thing, that's actually the least lightly used interaction, right? I think the most common one through Patient Navigator is what's the status of my eyewear order? And the next is, can I get a copy of my receipt for HSA purposes? And the accessing the prescription was like the lowest utilized thing. But the insights that it gives you is it tells you, okay, who is accessing the prescription, and so maybe you have a follow-up campaign to those folks. So again, data is your friend.
Yeah, I totally agree. The patients who needed the prescription, they were asking for it anyways. Now you have just a better way to track those
Right.
things, and that's taking up less staff time. So it's not been a non-issue for our office. Yeah.
Yeah, definitely those little things add up, those little interactions, and definitely when I'm working from my seat to try and improve things related to the EHR side of Encompass, a term that we use within our design team a lot is cognitive load. So it's not always even just the amount of like clicks and things like that. It's how often do I have to change what I'm thinking about and do a new task and like try to pivot. You have all these distractions when you're working with patients, and you're managing a busy practice. And so to the extent that you can automate those interactions, those things were normal, it might just take a person 2 minutes to send the prescription to the patient or to go into their chart and print it off for them. But to be able to say like, oh no, it's on your phone. You just go ahead and tap the link and it's right there waiting for you. It's like all those things add up and culminate in your staff, I feel like, just feeling a lot more liberated, to focus on the things that matter. Um, on that note, as we're talking about advancements in both patient engagement, Charlie, you mentioned Encompass Scribe, as well as some other things that are on the horizon. I kind of want to cast our view forward a little bit. And I want to hear from both of you. We'll start with Charlie about, how you see technology transforming patient care and also practice management in the future. Let's say, let's say like the next 5 to 10 years. What's your viewpoint there?
Oh yeah, that's a long ways out. I hope I hope I get 10% of it correct.
Yeah.
But I think let me just say I think there's three major transformations coming, and they may get here far sooner than 5 to 10 years because technology is moving so fast. So first, I think I coined the term invisible integration. It's where the technology itself becomes invisible. You won't be using the EHR or logging into practice management. You'll just be taking care of patients. And the technology will enable that seamlessly in the background. So that's, it seems like a very far out concept, but with some of the advancements that are happening, you can see that that's definitely the trend of where software and solutions are going. And a lot of that is powered by AI, right? And artificial intelligence. And so that'll be the second trend, right? Artificial intelligence will handle a lot of the administrative burden that is out there today, from documentation to insurance verification, prior authorizations, coding. All of that will happen automatically. I think Encompass Scribe is just the beginning. We're just starting to scratch the surface in that area. And third, and I think this is where it gets really interesting, data will become a huge competitive advantage. Not just having the data, but having the intelligence that helps you act on it. And so your system won't tell you that won't just tell you that the patient's overdue. It'll tell you which overdue patients are most likely to respond to outreach and what message will resonate. It won't just show you your frame inventory. It will predict like which styles will move in your specific market based on the demographic trends and the purchasing patterns. So all of this is accelerating at breakneck speed. And I think over the next 5 to 10 years, the practices that leverage data and AI, not just for efficiency, but for strategic advantage, are going to be, they'll know their patients better. They'll anticipate the market needs and the needs of their patients faster. They'll operate more profitably than competitors who are still running on gut feel and manual processes.
Yeah, that's really interesting. Obviously, like all industries are talking about artificial intelligence right now and the opportunity to, actually provide value by automating things and providing insights. I'm curious though, Dr. Moos, from your perspective as a doctor working with patients in the exam room, like what is your take? What is your perspective on artificial intelligence in the exam room? And how do you think what's your pulse on like patient expectations, what their feelings are around AI in the exam room? Any thoughts at all? Are they curious? What's your perspective?
Yeah, this whole new realm of AI, it's fascinating. And I think Charlie had kind of touched on this, allowing doctors just to see patients. So, everyone's kind of, oh my gosh, is my job going to get replaced by AI? I don't think our jobs are going anywhere, but it's how are we going to embrace AI to make our jobs easier? And patients are going to keep coming to us because they like that human connection. They want to, be cared for. And instead of using our time, to be typing in, information into fields, having AI do that for us, or, taking an image and already having, a list of differential diagnoses already provided for you. There's all these things that are very intriguing to me about how that can just allow me to provide better care for my patients, and spend more time with our patients. I feel like we're always kind of on a time crunch. We're always falling behind, or there's always, something to be doing. So if we can, streamline that with AI, it sounds exciting.
Yeah, I'm looking
Yeah.
forward to it as a patient, right? I mean, even if you go into primary care today, everything feels so rushed. It's like they've got 5 minutes to spend. The doctor has 5 minutes to spend with you, and then they're on to the next person. And it's like, it just it feels like you're and half of that time they're spending with you with their backs turned to you because they're typing something into the EHR. And so yeah, I think it's gonna, it's an interesting observation there about how as you relieve kind of more of that administrative work, it actually creates a better patient experience and more time to interact with the patients.
Yeah,
And
just
Charlie, I had one. Oh, sorry, Jeremy.
no,
I
no,
just had
please,
one
Dr. Moos.
follow-up question about the AI scribe that you guys are launching. I know you will have lots of information about this at Vision Expo, but I think for us doctors, we've been hearing about AI scribe type of opportunities, and we're just worried that it's just going to be like this long soap note. It's just a recording of everything that we talked about, and then it gets like thrown in a chart. But to my understanding, I haven't actually demoed this yet, but with the AI scribe that you're talking about, it's actually plugging those into the fields that we already have in EPM. So we're really just saying those numbers out loud, and it's getting plugged into the correct field, correct?
Yeah, so your worry is not misplaced at all, because most of I think virtually every scribe solution out there that I'm aware of today is they're good, but they're basically taking and transcribing that patient and doctor conversation into a note that then gets attached to the patient record, and the doctor still has to go through that transcription and enter relevant data into the health record so that you can do trending over time and all the other coding and everything else that has to happen. And our solution is taking it a step further, right? And so it's not just about the transcription of the conversation, which will happen, but then it's taking that transcription and automatically suggesting the inputs that need to happen into the patient chart, which then the doctor has full control over. They review, yep, that's what it should be. And then it gets it's accepted and it goes right into the patient chart. So it's as if the end state, as if you had documented all this stuff by tapping or touching or typing the various information in. And so it's a huge game changer. And we'll start out initially with covering more of the medical side. I mentioned optometry is shifting more medical, and then we'll make our way into the vision exam and cover the refraction and the other components of the exam. So, and that's all happening very fast. So between the time we GA and then the time that we enhance, you're going to see to cover like the vision exam components is going to happen very quickly. And we're talking, the advancement is so fast. It's weeks and months, not quarters and years.
Yeah, it's really exciting. This is an area that I, of course, am super excited about because I've been spending my time in here for, over a year. But the to hone in on something you mentioned, Charlie, and Dr. Mose, you brought up about like soap notes. Uh, I did talk to a doctor recently, and they are using a scribe solution. They're paying a couple $100s a month for the solution, and essentially what it does, he was just saying candidly, I don't have enough staff, and I feel like I'm always struggling to see the amount of patients at my practice, and so the scribe will record a bunch of soap notes for me, but then I'm spending an extra like hour and a half, 2 hours every day when I'm seeing patients, then transcribing that into the patient's record. And so all of that, adds up. It's not, it is allowing me to see more patients, but it's not saving me time in the end. So I think that piece is critical. And certainly for anybody who's evaluating like AI solutions for your practice, I would ask questions about, what is the end product? What does the AI actually output? Is it just a soap note, or is it putting into those structured fields, right? Am I getting my e-prescriptions? Am I getting my auto coding? Am I getting my referral letters? All the stuff that Charlie mentioned, like longitudinal data. If I if I'm practicing oculomics, right, being able to monitor progression over time. All those things are, I think, key to saving you time. So it doesn't actually feel like you're going back in time and having to read through a bunch of visit notes one at a time to understand what was happening with the patient. Um, and on in regards to like patient expectations, real quick, have either of you gone to the doctor and had your doctor say like, "Hey, is it okay if I use AI to help me document my exam today?"
Yeah, I have. So it's in primary care, right?
Yeah.
So it's already, it's out there. And Yeah, and my kids have too. And it's interesting to see the different takes on it. I'm like, sure, I'm plugged into technology. My kids are uh, uh, a little more cautious, and they're like, we're not sure what is this AI going to do, and so it's been an interesting dialogue with my kids on, well, here's what the AI is actually doing. It's not taking over for humans. It's really at this point at a stage where it's making people more productive. So I do think there's a healthy skepticism out there, and it probably varies by age.
Yeah, I think the skepticism is healthy, definitely, to have about any of these solutions. Dr. Mose, I don't know if you have also had that experience going in yet, or if no AI in the exam room for you yet.
No, our office that we go to must be a little behind Charlie's office, but no, there are still people, typing away and putting all of that stuff in. We do use it more like with my marketing team that we're using. We'll, use AI to like record conversation, and then they're using that to go back and give me summaries of things that we talked about and action items. So we've been using it for, meetings and things like that outside of still part of healthcare, right? But not direct patient care.
Interesting. Okay, so just to make sure I understand correctly, when you're having like your team meetings or you're talking with like the folks who are in charge of marketing, just to kind of help summarize discussions and get to the like key things that you want to market out to patients, you're using AI for that.
Yes, exactly.
Gotcha. Okay. Yeah, I mean, I think that's a really ingenious use. And just to tie off on like the patient experience, I had to I broke my toe like 6 months ago, and I had to go meet a new podiatrist. And I, never gone into podiatrist before, and never met this doctor before. And he asked me like, "Hey, is it okay if we use AI? If I use AI to record this exam?" And then we just sat down and had like a 15-minute conversation one on one. He never looked away to document anything, and I was like, this is one of the best encounters I've ever had within healthcare in my entire life, just because we were just talking about whatever. And I just felt like as a doctor he was having a great time because he could just be fully engaged. He wasn't having to think too much about where to document things. So anyways, yeah, if you can't tell, I'm very excited about where we're headed with this within Encompass. So this is something for sure that if anybody on the line here is coming to Vision Expo, please come by, stop by the booth. I would love to chat with you about this, as well as all the other things that are coming out for Encompass. And on that line, I do want to take some time to talk about one, like what's next for us, but also I want to address some of the questions that folks have. So um, in the chat, again, I just want to draw your attention. There's a Q&A section where you can ask questions. This is a great time if you have any questions you want to submit to clarify things you're curious about, how maybe Dr. Mose is using Encompass to address certain challenges, or maybe problems that you're running into that you're curious if there's any solutions for, or maybe you want to hear from Charlie some of his perspectives on where Encompass is headed, or addressing some of the emerging trends in eye care. I see we already do have one question from Jennifer, and this question is, I think, a great one. We've been talking about transcription, right? The the collection of data, not just the data just going to a spot where then I have to then pull it out and transcribe it, but how can we actually streamline workflow? So Jennifer asked, great that we can add our intake forms to EPM, but it would be even better if patient medication, allergies, medical history, etc., could import directly into EHR, and our techs would only need to confirm this information. Every second counts with the volume of patients we see. So, I can answer this question, Charlie, unless, if you have some
Go
thoughts
right
you
ahead.
want to.
We didn't pay Jennifer to ask that question, did we? No.
No, no, no. But it's great timing. Yeah. So we have a solution called Online Forms, which is set to roll out very shortly. Which essentially, just for folks who are in the webinar right now, if you're using the patient portal or you're using kiosk, I hope that those have been super helpful. Folks give us feedback that that's helping to streamline the intake process, but reaching the patient before they enter the actual office is an area where we're like really honing in on. So what we've built is a solution where essentially the patient schedules their appointment and they immediately get a text message that they can open on their phone, and then you have control of a much shorter, in comparison to like the kiosk or patient portal today, a much shorter list of questions that you can ask, that covers all these things, right? Medications, allergies, any of the pre-visit paperwork you need done. And actually all that stuff would then just go directly into the patient's record for the doctor or the technician to confirm as if they entered it through kiosk. So the difference is just that there's no app to download, it's texted right to the patient, and there's no need to transcribe any of that information that might be collected today through like your website intake form. So we're super, super excited about that. I think that's going to really, really help to streamline the intake process. Let's see.
And
I see another
one thing I
question.
just want to add on to, oh,
Yeah,
Jeremy, do you
please.
mind if I add one more thing? So I just recently found this out, but under medications tab, there is a way for you to import with your patient's consent their medications, so their current list of medications, because the forms are great, have the patient go and pre-fill those out. But half the time, when we have the paper version of this same thing, they go, they leave those things off. So it's nice being able to just import all of those medications. They're all spelled correctly, and the dosage is all there. And then you can also just review those with the patient. So that's alive and active right now if you want to use that.
Yeah, yeah, great plug there. That's a feature that I find a lot of folks sometimes aren't aware of, and it's a huge game changer, right? If you ask a patient like what medications are you taking, you'll often be like, well, I take a yellow pill for my cholesterol, and I don't know what the name of it is, and I'm taking this, I'm taking that. But Encompass integrates directly with the SureScripts network, which, if folks aren't familiar, SureScripts covers 99% of all pharmacies within the US. So if a patient got a prescription filled at a pharmacy, it's almost guaranteed that it's been logged within the SureScripts database. So you essentially can just grab that and pull it right into the patient's record. So you don't even have to ask them about their medications. Most of the practices that are getting out ahead in that intake space and leveraging like kiosk and patient portal and things like that, they're not even asking the patients about the medications because they know they can just pull them in electronically. Um, on this theme, Andrea asks, for the intake forms, are they able to be customized or are they preset? As well, is there any information the patient does not have access to via the portal that would still require any staff assistance? Yeah, so the online forms that we were talking about are going to be customizable. So if you don't want to ask the patient all of the questions that are on the form, you don't have to. And that's true of the patient portal and kiosks today as well. That's another thing folks might not be aware of. If you go into administration today, within the EHR side of Encompass, you're able to customize not only what questions are shown to the patient, but the verbiage. So just picking on an example, right? The out of the box term that SNOMED defines of a cerebrovascular incident, most patients don't know what that means, but you can change it to ask, do you have a history of stroke? And patients know what that means. So those are just some of the little examples. But yes, the online forms will be customizable. In regards to your second question, is there any information the patient does not have access to via the portal that would still require any staff assistance? I would I would say that with the solutions that are already there within the patient portal and that we're bringing to market soon, I think that our goal is to say ultimately no. But we don't know what we don't know. Charlie, I don't know if you have any thoughts here, but I would say there's pretty good coverage with the solutions that are either out there or are about to come out to alleviate the need for patients to really like ask for things to be sent to them manually.
Yeah. And, I would just, you're spot on, Jeremy. And, software is always, it's never, we're never done, right? So we're always evolving and always improving. It's one of the great things about Eyefinity. We invest heavily in the technology and the platform. So if there's something that we missed or isn't covered today, it'll be there in a future release.
Yeah. Yeah, great questions in regards to the intake forms. Definitely, it sounds like there's a lot of interest there to streamline things and provide a better engagement experience for the patients.
Dr. Moos mentioned something that it really resonated with me. I think the reason patients don't like filling out these forms of medications is because they can't pronounce or spell them,
Yeah.
which makes the download so much easier.
Yeah. Yeah, absolutely. I mean, again, it's so often like these software solutions, we try to design them or engineer them in such a way that it's addressing multiple problems. So it's, on the one hand, it's saving folks time, but also, you know, let's say that I'm a patient who ignored the text message, right, and didn't fill out their forms online. We want to empower an experience where you could have like, I don't know, like a QR code on your desk or something, right? You just text them a link again, and then they're just filling out, a very concise list of questions, and they're not having to like fill the same thing out year to year, but it's actually saying like, hey, here's what we know, what's changed, because all that stuff adds up, not just for your staff, but for your patients as well. Um, all right, we're going to pivot a little bit. I want to address this question from Denise. So Denise says, will the AI scribe be available for the technicians also? They spend a lot of time looking at the screen and not the patient. So I can take this one as well. And Charlie, if you want to add anything, you can. So the answer is yes. When you use Encompass Scribe, your technicians will have access to it. And that's going to be really helpful because one of the things that Encompass Scribe can do is it can collect the chief complaint and history of present illness from the patient. So instead of going through and asking all the questions that are on that list within Encompass today, you can have your technicians essentially just ask the patient what's going on, still reference that list to ask those probing questions to get more of the history of present illness out, but all of that will be collected and all the nuances of what the patient actually said will be recorded in the patient's record within the chief complaint section. Charlie also mentioned that we're focusing on the medical side of capturing like the patient's their diagnoses, the findings, your plans, your prescriptions, your referrals, those sorts of things. And then the vision exam elements are going to be coming pretty shortly thereafter. But that's another thing that the technicians will eventually be able to take advantage of is essentially be able to just say out loud, okay, maybe I took 3 IOP readings for each eye. Sometimes practices do that. So I could say left eye, IOP is 17, 18, and 21. Right eye is 18, 19, 20, and all that stuff would just be documented as opposed to having to punch that in, look down at the screen to do that today. These are
Good
awesome
questions.
questions.
Yeah.
Yeah. Yeah. These are
A lot of
fantastic.
excitement out there.
Yeah, I think this is I'm not seeing any more questions in the chat, and we are getting close to the top of the hour. So I would love to take some time, just Dr. Moos, Charlie, maybe if you have some closing remarks, takeaways that you think folks should walk away from this webinar from. I'll start with you, Dr. Moos. Anything you think folks should walk away with today in terms of like things you value that you've gotten out of using Encompass that you think other folks could take advantage of as well?
Yeah, I really just think that Encompass has helped us, from bookend to bookend on the practice, streamlining revenue cycle performance, integrating with our optical management, just making sure, our front end billing accurately, and then the back end billing reconciliation is easy. And then also, what Charlie's been sharing with us, you guys kind of looking ahead and seeing what that's going to look like for the future. Like you're not just stopping here, you're always trying to improve what's happening. When we give feedback on features that we want, you're listening and you're trying to incorporate those. So we appreciate that you are continuing to develop the product and work with us to continue to support our practices and let private practice thrive.
Yeah, Dr. Moos, thanks. We value the input from all of our customers, and we have thousands of private practices across the country, and we have also power. I think seven, maybe 20 of the top 50 optical retailers across the country. So we have a diverse set of customers that give us feedback, and it's just so valuable to us. And so again, I just shout out to all of our customers that are out there watching this, and just really keep the feedback coming. We appreciate it.
Yeah, absolutely. Um, Charlie, do you want to add anything in terms of takeaways for folks as they're coming away from this webinar?
Yeah, I think just a quick recap, right? First, technology should eliminate friction, not create it, right? And so the best tools work inside the workflows you're already using. They don't add another system to manage. And that's really what we're focused on with our Encompass platform. And you see that with Encompass Scribe, generating structured clinical notes directly into your EHR fields. The TriZetto integration for medical that we talked about, letting you check claim status without having to switch systems. And online payments, right, that let patients pay from their phone, comes in automatically, right? So these are, just some of the examples of how, we're trying to make the platform work for practices. Second, think platform, not point solutions. So, the practices winning today are the ones that aren't juggling 5 different logins and cobbling together all these disconnected tools. They're using unified systems where everything works together. Clinical documentation, flows into billing, patient engagement connects to scheduling, your business intelligence, shows you what's actually happening. That integration creates real continuity across the entire patient journey. And then third, I think the future belongs to practices that turn data right into decisions. And so you already have, Dr. Moos pointed this out, you have a treasure trove of data. Every exam, every transaction, every patient interaction generates information. The question is whether that data is really helping you run a smarter practice, or it's just creating reports that you don't have time to read. So those are kind of my 3 takeaways.
Those are great takeaways, and I hope folks who are listening today got some good learnings out of this discussion, and hopefully you're curious and want to learn more. So I think we'll wrap it up at this point. And so I'd say thank you, of course, Charlie, for joining us today, and thanks, Dr. Moos, especially. Really appreciate you joining and sharing your insights today. And thank you everyone who joined for the questions. I think that was a great Q&A. I'll reinforce one thing again that Charlie mentioned, which is the feedback that we hear from folks who are using Encompass. Please, please, please don't be shy about sharing that feedback. Me and my team and my colleagues here, we read the comments that you leave for us, whether it be online, in our support community, in the surveys that you see. And that's the way that we improve the platform. Especially if you're thinking about coming to to Vision Expo. That's my favorite part of going to these events, is getting to talk to people live in person and ask them questions about how they've implemented Encompass, how it's working for their practice. So please, if you're thinking about coming down to Orlando, we're going to be there March 12th through the 14th. We'll be at the VSP booth. That's number 410 on the show floor. You can get a live demo of the Encompass platform. We're also going to be demoing Encompass Scribe, so you can get hands-on experience with that as well if it's something that you're thinking about using. I would love personally to get to chat with each and every one of you. So please don't be shy about coming by the booth. With that in mind, we'll go ahead and call it here. Thank you again for joining us for See What's Next, getting real about the future of eye care. We appreciate your time and your commitment to elevating patient care. Thanks,
Yes,
everyone.
thank you. Thank you, everyone.